hypnosis does is it causes physiological changes in the body, which are measurable, and it creates positive clinical outcomes. So the entry point may be psychological, but the effects are definitely physiological, observable, and measurable. I've observed it. So hypnosis works with physiology. It's not on the outside. And by this, I mean, you see changes in the autonomic nervous system. And these are measurable changes. You see a decrease in heart rate, a decrease in blood pressure. You see an increase in parasympathetic tone. You see a decrease in stress hormones like cortisol. And this state allows you to access your subconscious mind. And by doing so, we're able to change perception, emotions, sensations, and behaviors. Self-hypnosis, it's very empowering. And that's what I want to share and help my patients with, right? So, I mean, science and medicine is my core passion. I believe in it. I'm not saying this replaces it, but it's definitely a very, very useful complementary tool that can add.
So whoever is watching this, getting it on the internet or from the website of the South African Institute of Hypnotism, welcome. Thank you very much. I am so excited about this topic about medicine meeting hypnosis. And we have this absolute fortune to have a medical doctor who recently qualified in hypnosis practices. And now here we can learn firsthand what that means to her. And maybe we have to rethink what healing could really mean. So warm welcome to you, Tascia.
Thank you, Claudia. It's actually quite an honor and a privilege to be here. Thank you for inviting me.
And for you to take the time out of your hectic schedule to agree to this interview, that's a real privilege, and I appreciate it. Maybe we should start. As a medical doctor, maybe you give us just a little bit of background, what kind of a doctor you are, for how long, and then what, of course, is of super interest. What made you consider hypnosis? Was this to enhance your medical practice, or was it completely for private reasons? How did that journey start?
Okay, so I'll try and be brief. I'm a general practitioner, so I'm working in private practice, a family practice. I qualified a long time ago. I qualified in 2000. So I did my internship at Johannesburg General. I did my comm service in a little hospital in Carolina. And then I worked in Tara, which is a psychiatric hospital. I was considering doing psychiatry. So I was in Tara for 6 months. I was in the lockup ward doing ECT, electroconvulsive therapy. So I was with the quite highly psychotic patients, a lot of borderline personalities. But I didn't quite enjoy it because I felt it was quite restrictive. I missed doing the hands-on, the procedures and being exposed to the variety. So then I went back I worked in medical casualty in Joburg Gen. I worked in trauma. I worked in all the Netcare casualties from Sunning Hill to Union to Garden City to Mill Park, until I eventually settled in private practice. And then I took over the practice in 2010, and that's where I've been enjoying it. It's really nice. I have amazing patients, and so they say choose a job that you love, and then you'll never work a day in your life. So that's what I'm living. I feel like a little bit of a cheat because I don't feel like my job is work. So very few people can say that. So I think I'm quite blessed to have that. So that's where I am in terms of the medical. And you being a general practitioner, you see a whole wide variety of conditions. And then to get back to your question about how I got interested in hypnosis. So my interest started after reading the book Many Lives, Many Masters. And I've since read all the book in the series. So what really intrigued me was the fact that these patients had quite significant struggles. And despite being on medication, they weren't achieving actually lasting wellness. Symptoms were being controlled to a point with medication, but ultimately they were still stuck in that same cycle until they were introduced to hypnosis. And in I mean, that book, it was particularly past life regression. So that really drew me in, and I was so fascinated and I was like so intrigued. And then I started noticing amongst my own patients that there was a pattern emerging. There were certain patients who presented with maybe non-specific symptoms, but these symptoms were really troubling them. It was affecting their lives. And we'd investigate, I mean, fully investigate, do everything. Yet all investigations come back showing, I mean, there's nothing that we can pinpoint, can't find an underlying cause. So if you can't find something, you can't treat it. Then I'm stuck. So I refer them on to a specialist. They go to a specialist, go through the same whole cycle again. Still nothing, can't find anything. So what happens to these patients? They get referred to a psychiatrist. And then ultimately what happens? They get put on medication again. But the medication doesn't really solve the problem. So again, manages the symptoms to a point, but then you deal with side effects and the struggle continues. It seems like an endless cycle. So for me, I was like, no, man, surely we can't leave these people. I mean, surely there's a way to help them because I've always believed in a holistic approach. And then I'm in like hypnosis. This was like, a light bulb moment, like, maybe there's something here. And so that's how, but granted, I think this is not brief, sorry, Claudia, but so granted, I read that book in 2010. I only started the journey last year in 2025. But life happens, you are busy with young children. And then, unfortunately for me, my life took a really bad turn in 2024. I had a devastating loss. I lost my husband unexpectedly. And I think I'll try not to get emotional. My sister gave me the last book to read, Only Love is Real. And she knew because she's a physiotherapist. So we always discussed hypnosis and how I'd like to implement it and add it to my practice. And she said to me, listen, I think this is the time. I think she knew I needed something. I needed to find more purpose. I needed something. So to be honest with you, Claudia, this course was like a lifeline for me. It helped me in my healing journey. So I think it's beneficial on personally and professionally. So yeah. So yeah, that's the story of it took me a long time to get here, but again, I think the universe works in mysterious ways and things happen when they're supposed to happen. So yeah, that's what led me to starting this course in the beginning of last year. So, and it's been a lifesaver for me.
Thank you for that. Wow. And thank you for sharing such deeply personal matters. I'm sorry for your loss. Can't be easy. And now that you have added the knowledge of hypnosis practices in addition to your what sounds super intense medical history, if without looking at the textbooks of what you've learned, how would you define hypnosis with your medical background?
So, I think the easiest way to define it is to, I feel like hypnosis is focused attention, deep relaxation, and a heightened suggestibility. And this state allows you to access your subconscious mind. And by doing so, we're able to change perception, emotions, sensations, and behaviors. So I think it's accessing that subconscious mind is the key, which can only be achieved through deep relaxation and focused concentration.
Yeah, yeah, good. Thank you for that. So your desire to help your patients in a, if I may call it, in a bit more holistic way, other than with treatments or prescriptions or things like that. Has this materialized for you? Have you been able to include some of the techniques that you learned in hypnosis with your patients?
Yeah, definitely. So I've done the Hypnomed course as well. So that was really amazing and mind blowing. So I obviously with doing case studies, I've had experience in doing hypnosis sessions with quite a few of my patients, and it's amazing that a lot of them are very open to it. There was a patient that I'm going to just give you a case that I had done recently. So there's a patient that I had done a few sessions of hypnosis with. I did a few resource sessions, and she's an older woman who had sustained a head injury to her forehead. She had a hematoma on her forehead. So she came to me 2 weeks after the injury. So she had been treated at casualty because it was on a weekend. But this hematoma was quite significant and it was creating pressure, and it wasn't resolving. So now the difficulty when a hematoma has been there for 2 weeks is that the blood coagulates and thickens, right? So drainage is quite difficult because the blood is thicker. It's not easy to drain. You can drain it easier when it's more in the acute stages. But now she trusts me and she didn't want to go to a plastic surgeon. She said, no, please. I mean, sometimes they think I can solve all their problems. So I said, okay, let's. And she was also she's quite afraid of needles and blades and all of that. So I said, okay, let's do this. Let's try, if you're open to it, let's try hypnosis and let's induce anesthesia in that area, and let me use relaxation, and let's try and gently drain this and resolve it. And she was like, oh, good, let's go for it. So because I did hypnosis with her, just with subjects, so I did a rapid induction, and then I created anesthesia, made sure that she wasn't feeling anything. And then I proceeded to drain, but the drainage was, I only drained about 1 ml. So what happens, you drain a bit and then it fills up again. So it wasn't really significant. So I said, listen, I'm not happy. It's not where I'd like it to be. So can we go a little bit further? Can I make a little incision? And can I just gently just get all of that unwanted fluid out that's causing all this discomfort and pressure? And she said, great. So then we proceeded, and while I was there, I kept talking to her with good suggestions
Hold
in the
on, hold
control
on,
room.
hold on. Did you
Yeah.
not put an anesthetic? Did you not use an anesthetic?
No, no, I didn't. I
Oh,
kept checking. So I made a little incision,
yeah,
and she was like calm, and I kept deepening, talking the whole time.
yes,
And
yes.
then I kept deepening. I did the okay. I don't know if I did the right thing. I was in control room of the mind,
Yeah, yeah.
and then I gently carried on. Breaking down this hematoma. It took me about 40 minutes,
Yeah.
but I successfully drained, and she was happy, and this lesion resolved so much quicker, like within 2, 3 days. There's not a scar on her forehead, and it's looking absolutely
Amazing.
beautiful. She is absolutely happy. So I was very happy. So I was like, so
That,
this just like was a convincer for me. I was like, okay, because
of
I mean, I
course.
hadn't really done, I mean, we did it in class, and then I said, I knew she was a good subject. So I wouldn't have just, I can feel when they're good subjects. I said, okay, let's do this. So the reason I did it with her is, okay, I wanted to convince her for myself, for one. I knew she was a good subject, and I knew that she had this fear of the needles and, all the medical equipment. So I didn't want to feed into that fear. So yeah, that's how I used it. So I hope
Wow.
you can tell me if it was okay, the
It
right thing. I just
sounds
followed guts.
no, I mean, I love your bravery and your courage, because yes, we do practice during the courses, but I mean the proof is always in the pudding. And I had
Exactly.
and I have no medical background at all, and I have been invited on a few occasions for dental procedures, and once for, I don't know what the technical term is, a hysterectomy that wasn't done through a cut that went inside of her, and
Yeah.
I don't know
Laparoscopically, yeah.
what
Yeah.
you call that. And we also didn't use any anesthetic whatsoever. And when I tell these stories in class, the eyes of the students, they get bigger and bigger. It's almost unbelievable, isn't it?
Yeah, and I think also, with me, yeah, I need proof, I need convincing. I mean, the stories are amazing, but there's always that little voice like, is it really true? So like it's a convincer, right? And yeah, I was brave because I was confident in also in my patient, and I knew how much he wanted it, right?
Mm-hmm.
So I think also that is, and also I think with the course also I think my instincts have gotten a lot stronger.
Mm-hmm.
So I could feel the energy, and I knew she wanted it so badly. So she wanting it so badly, and she trusting me, that was just a recipe for success, right? And at
Mm-hmm.
any point, if I kept checking, if any point she felt pain or discomfort, I would have given her anesthetic.
Yeah.
So, I mean, I was prepared. I kept checking, I kept checking. But she just said she felt so relaxed. She said, I'm so deeply relaxed. Are you done? Are you finished? I could sleep. I'm like,
Yeah.
okay, no, it's fine. You could sleep if you want to. It's all good. So it was really nice. I'm really, I actually submitted that as my HypnoMed case study.
Yeah,
So
that's quite amazing. That's quite
yeah.
and I'm sure you have more of these stories, and maybe we have time for another one in a little while.
Yeah.
Because this let's swap back to your personal experience. You just mentioned something that
Mm.
you said something like your senses are heightened because
Yeah.
of the courses. What did you mean by that?
I don't know. I feel like my intuition is stronger. I don't know. It might sound a little bit out there, but I just feel like I don't know. It's from my own having my own hypnosis sessions. I mean, we obviously in class there's a lot of group sessions. I've done uh, two sessions, and I've been personally doing. I mean, self hypnosis just to help myself, because I mean, life is never easygoing. I need to regulate my nervous system. And I personally don't like using medication.
Mm.
So I tried my best to try and regulate myself. So, I mean, having uh, had done the self hypnosis, it's very empowering. And that's what I want to share and help my patients with, right? So, I mean, science and medicine is my core passion. I believe in it. I'm not saying this replaces it, but it's definitely a very, very useful complementary tool that can add a truly holistic approach to patient care, to people's well-being. And I feel like it's so empowering. I mean, if you can empower an individual, they'll also feel more in control of their
Mm.
own body and their own symptoms, and that itself will decrease the stress response. you know so I think with that, so getting back to you saying, I think maybe with doing my own self hypnosis, I think I'm accessing my subconscious mind uh, more. What's the word?
More fully?
Uh, yeah, more fully, and I'm doing a better job of accessing my subconscious mind.
You
I have
know,
more access.
while you say this, um, something came up for me. It is when we do the courses and we learn about the powers of the subconscious mind. I don't I don't think that no, let me let me say that the other way around. The subconscious mind is always there and it's always
Mm,
available with all its qualities, right?
mm,
But we're living in a culture, we're living in a society where our logic and our analytical mind, our conscious mind, is given absolute priority. And
mm,
you have been for a very long time also in a field that is very dominantly using the
mm,
conscious mind, logic,
mm,
analysis,
mm,
and things like
mm,
that. So,
mm,
what I think is, and that's also super valuable. Nobody is dismissing the
mm,
conscious and the logic and the analysis. But I think what happens when we do the courses and we start understanding all the values that are available when we access the subconscious through relaxation, through bypassing that analysis, we
mm,
kind of develop a harmony where that gut feel, that feeling, that intuition, as you call it, which probably is also always there, but it's been
mm,
overwritten prior
mm.
by what our conscious mind is telling us.
Yeah. So just to add to that, I think what happens is that the conscious mind is too loud. So I think it dampens and softens the subconscious mind. And I know particularly with me, I'm an overthinker of note. So that conscious analytical is just so loud and it dampened that, right? So that connection, there's a disconnect. So I think also if I had to describe my first experience under hypnosis, right, I didn't know what to expect.
Yes.
So I was excited. I was like, oh, what is going to be? I'm going to be like, oh, I didn't know what to expect. And it was obviously a group setting in class. And it was, so what I felt was, it was just a calm awareness. I felt my thoughts slowing down. I felt focused relaxation, but probably the most relaxed that I've ever felt. And my inner voice got quieter.
Mm-hmm.
And that was amazing.
Mm-hmm.
That was liberating. That was so nice. That was brilliant. Like, I didn't have that inner voice. That was like, wow. For me, that was like the best feeling. So that was my very first experience. And then, like my sister and I both the same, right? And we're like, did you feel that? Like, what was that like for you? It was just quietening that inner voice was nice, actually.
Of course. Because what is that inner voice? The inner voice is your conscious mind that
Mm,
has a function to keep you safe together with your nervous system. It's a kind of the spokesperson of the nervous system, you know, and our
mm,
belief systems and our past. So I like to always say that this inner chatter, what that the mind gives us, is kind of the mind does a statistical review of the past and projects it to what is now and what could be, and then gives all the warning signs. All the
yeah,
what if,
yeah,
right?
yeah,
And this is not, we shouldn't judge this negatively because
yeah,
it's just trying to keep us safe. It
yeah,
thinks,
protective.
familiarity equals safety, right? And
Yeah,
that's sometimes the problem when we want to overcome certain things is that when we don't believe in something that we haven't experienced yet. So we're holding on to that familiarity, and that hinders us from opening the doors into so much in endless potential, really. Yeah.
yeah. No, it's amazing. So yeah, definitely, with hypnosis, there's definitely physiological effects. There's no doubt about it. I mean, I've observed it. So hypnosis works with physiology. It's not on the outside. And by this I mean you see changes in the autonomic nervous system. And these are measurable changes. You see a decrease in heart rate, a decrease in blood pressure. You see an increase in parasympathetic tone. You see a decrease in stress hormones like cortisol, decrease in inflammation, which you can measure with inflammatory markers. You see changes in brain activity, which you can assess with neuroimaging studies like MRIs. You can do EEGs. So there is measurable changes that occur. So it is backed by science. It's not like out there. It is definitely backed by science.
Thank you for that.
So,
Thank you for bringing that up. I would have asked otherwise. You know, when I started studying 27 years ago hypnosis, we were shown some videos. So I don't know whether that's still true nowadays. That's why I have to say that. But we've been shown videos from America where first aiders, firemen, these kind of people are trained in hypnosis. And there were stories, and again, I don't know whether my medical terms are correct, where people that at the scene had 4 degrees burns, with the paramedic giving cooling suggestions and healing suggestions, they arrived at hospital with lesser degree burns. You know,
yeah,
why
yeah,
do you think? So I mean, this is just the tip of the iceberg of the stories
yeah,
you can tell and I can tell. You from
yeah.
a medical background, me totally from a non-medical background. And yet we have so many stories to tell in this, just two of us. You know, a colleague of mine years ago had removed tonsils in an adult. And it was only possible because in those days, people weren't as open to hypnosis as they are nowadays, which is another question I have just now. And because it was also a lady on the courses, and she wasn't a very good subject. And the reason why it was allowed, because her husband, also on the courses, was the anesthetist and knew the surgeon. And they said, we want to try this out, to do this tonsillitis, I think you call it, or the removal,
The tonsillectomy. Yeah, tonsillectomy.
tonsillectomy in an adult, which I believe is very painful.
Yeah, it is very painful, longer recovery,
Yeah, and they
more
did that,
painful.
and they did that without any anesthetic, with the husband
Oh,
standing
wow.
by, you know, having the anesthetic ready to be used.
Yeah.
And when it was done, she sat up in theater on the bed and said, I would like a glass of Coke.
Wow. Yeah, I can believe that. I can definitely believe that.
And we
It's
don't even touch childbirth, you know, where
yeah.
I mean, that's how I got into it, because it was pure synchronicity, I believe, that I met an obstetrician that taught me self-hypnosis for painless childbirth. And I mean, what a difference when I hear the other women scream in the yard, and mine was over in 2 hours. And yes, of course, I had discomfort, but my excitement was much bigger than that. Yeah, so tell me now we're talking terms sometimes that are, yeah, bordering a little bit out there, you know, subconscious mind and intuition and all these things.
Yeah, yeah,
When you
yeah.
speak to colleagues, or maybe even for yourself, has this challenged some of your strictly medical or scientific beliefs?
Yeah, so I mean, so remember, I'm actually quite open-minded. I mean, I always listen to both sides, but there are people who don't. Some people are just strictly, it has to be a very black and white, let me say. They don't look at anything in the gray area. So you have to support it with evidence. So with your scientific minds, then you would talk about more, bring up the clinical evidence, like how people under hypnosis, how what are the changes that occur. I mean, the deep relaxation, what happens when you deeply relax. So they basically, the observable measurable changes would be a decrease in the sympathetic nervous system, which is your fight and flight response, and an increase in your parasympathetic nervous system, which is your rest and digest. So changes in these two systems will then bring about a decrease in your stress hormones. decrease in heart rate, decrease in blood pressure, decrease in muscle tension. And what is this doing? This is basically decreasing your stress response, because we know how damaging stress is, right? What does stress do to the body? Stress aggravates and worsens so many conditions like pain, gastric conditions, irritable bowel, insomnia, blood pressure. I think it actually, let's just say it aggravates everything, right? But what hypnosis does is it causes physiological changes in the body, which are measurable, and it has it creates positive clinical outcomes. So the entry point may be psychological, but the effects are definitely physiological, observable, and measurable, right? So, I mean, that's how I would explain it. But like, so if I had a very cynical colleague, again, I'll go back to the thing, proof is in the pudding. So what I would do is I would say, listen, after we have the discussion and we talk clinical terms and physiology, I'd say, listen, the best thing is let's do a session, right? Let's do a session. And a proper pre-talk will address misconception and put it to bed. And then we get you ready. We do a mind-blowing session. And then that's the convincer. Well, I think.
Yeah.
Well, that's how I would. That's how I would deal with a colleague.
Yeah.
A cynical colleague. Like, I think proof is in the pudding, right?
Yeah.
And I think the difficulty that hypnosis practitioners face is that there's a lot of misconceptions. There's not a lot of education. Obviously, there's always a preference for using medication. I think also medicine also focus on that divide between mind and body. So that's a big problem. So clinical medicine is excellent at diagnosing a physical problem, treating acute illness, whether it's using pharmacological measures or procedures to directly change the body. But the gap is in the middle ground. It's in that mind-body connection. And that's where hypnosis quietly shines, because we know that thoughts and emotions and perceptions can aggravate and worsen symptoms in a lot of conditions, especially like pain, gastrointestinal, insomnia, headaches, migraines. I mean, there's so many, right? But I think this is where we need to look at that mind-body connection, because hypnotic suggestion works so beautifully in reducing pain, changing perception, and altering emotions. So I think it leverages neuroplasticity and so brilliantly. I mean, we strengthen those neural pathways, and we just enhance overall well-being. It's amazing. So I think as a complementary tool, it can work so brilliantly with medicine to provide a holistic approach to patient care, resulting in lasting, sustained wellness. We'll empower our patients. There's so many benefits there.
Yeah. So
sorry, I'm going on here. Sorry.
No, you're doing brilliantly. This is gold. I just wonder. I mean, you obviously converted. You have been convinced, not by just watching and learning, but by also doing it, applying it. Why do you think the hypnosis is not utilized more in the medical field?
So again, I'll say it's because of the misconceptions, right? Time constraints, because remember also, if I had to look at my normal consultation, is much shorter than a hypnosis session, right? So personally, that's where I'm struggling at the moment, because I don't have enough hours in the day, because I need to, my primary focus is my medical practice, but I also want to help those individuals that will benefit so much from the hypnosis, right? So what I've had to do often is start my day much earlier, or end it much later just because the sessions are longer. So time constraints, I think with other medical professionals, we need to address the misconceptions. The other issue is obviously it's not supported by medical aids. So, the costing is the issue. Also, I mean, a lot of people, it's you want to treat with medication, right? Not everyone believes that we can find a holistic way. I mean, medicine works, don't get me wrong, there's a place for it, but there's some places where medication is just a band-aid. I mean, I believe we have those faulty programs where, especially in mental illness, there's those faulty programs. The medication subdues it, it keeps it at bay, but the mind is so powerful, it pushes back. And that's how I explain to patients, it pushes back, because often I have a patient who come to me and say, listen, I've been put on this antidepressant by my psychiatrist. I've been on it for like 10 years, but I feel like it's not working anymore. Can you increase the dose? Can you change it? But the issue is, it's not the medication. The medication was just holding it at bay, but the faulty program is pushing back. So, I mean, we can increase the dosage, but then I have to warn them, listen, then we have to deal with possible side effects. And then you also lose that person. They become blunted. I mean, they become vacant. I've seen it. So for me, how do I help you where we don't lose the essence of who you truly are? Because, I mean, we are human beings. You can't lose that essence. You can't become a robot. So for me, as a complementary tool, I'm not saying we're stopping medication, but instead of increasing the dosage, how can I help you?
Yeah.
Now, there's an underlying issue. If we can, so no one gets to the underlying issue. If we can identify the underlying issue, and if we can release it and we can deal with it, we can move on, we can move forward, right? We can heal. But there's no true healing with just medicating and suppressing. So that's where I feel like I needed to look at something to help those patients where medication is not helping them. So like I couldn't sit by. I'm like, no, I can't just leave you, because I felt helpless. And that's why I feel like hypnotherapy and hypnosis is like a lifeline, right? But again, people need to be open to it. They need to understand it. There's too many misconceptions, Claudia. There still is too many misconceptions.
Yeah, but what you're doing here right now, what we're doing with having this interview, we're giving our contribution to dispel these misconceptions, that it is a down-to-earth practice or modality that works beautiful as complementary in addition to medical treatments. And so I'm going to guide us towards something which is maybe not 100% fair, but how I would like to start. So with this case study that you described, that you used hypnosis on your patient to induce anesthesia without using any chemical. Is that correct? Okay.
Yes.
So just tell us, and how did you do that? Normally, when I go to the dentist and he gives me an injection and then it gets numb and then he can do his procedure. Now, and I mean, of course I know, but I'm explaining it for the listener. Now, you don't have to go into too much details, but in theory, so how can that get numb when you don't inject a chemical in there?
Okay, so that's basically because so I got the patient into a state of deep relaxation, right? So thereby there's focused attention. So we access the subconscious mind. And then when you access the subconscious mind, you're now changing perception.
Yes.
So you're changing perception.
How do you do that? How do you change?
The sensation. So, I mean, with suggestions.
Oh, so just with words, no?
With words, yes. Okay, so it's with words. It's talking to the patient.
Okay.
So talking to the patient, visualization. So it's imagery, guided visualizations and imagery. And this is how the beauty of it, because now the brain is visualizing and imagining and making this happen. If that's if I'm stating it correctly.
Yeah, no, absolutely. So, absolutely. It's perfect. I just wanted for the listeners to hear that it wasn't anything like swinging pocket watches or I don't know what people might.
It was just with words. Yeah, just with words.
It's okay. We have to enter this.
Also, yeah, it's also because also there's trust, right?
Sure.
So I feel like I'm blessed and at an advantage because I've gained the trust of my patients, and also, honestly speaking, being a doctor, and I am a very ethical person. I will not do anything that goes against, we do no harm. I live by the Hippocratic Oath. Yeah. So patient, I think that rapport building is easier. I don't know if I'm
no, absolutely.
Yeah, it's easier, right? So that for me, I think is an advantage because the trust is there. It doesn't. It doesn't take a lot. Like rapport, I already have the rapport. Yeah. So I can. So patients, when I discuss hypnosis with them and therapy, they're so open to it. So they want to try. They're excited about it. So hopefully, I am converting and spreading the word.
It would be nice. It would be nice because I have had a lot of access to dentists because hypnotherapy is very known in dental procedures and so many adjoining fields like bruxism or grinding and
yes.
Fear of needles, plain relaxation because people go in a flat spin when they just hear the word dentist or whatever,
Yes.
But I just want I want to take this a step further, this little journey about just using words, which you just explained to us in this particular patient has led to her having an area of her face anesthetized so that you could actually make an incision, and she still felt completely relaxed on the verge of falling asleep. That's what you said to us, no?
Yeah.
So now these power of these words, given all the scenario, the rapport and the trust, that's all established, let's say, and medical treatment. I mean, that's one of the things we are really strong on in our training. We are not replacing medical treatments whatsoever. We are the non-medical branch of those. So we don't diagnose, we don't prescribe, we don't treat. And our preference is always that whoever comes to us with a medical condition or a psychological condition, that they rather are in proper healthcare, under proper healthcare before we actually start working with them. But then we have the time because we're not pushed by having all these patients lined up, and we just do that and then we can help. So now here comes the story. Now let's say now, and this is true, and there is an 8-year-old girl that was diagnosed. 8-year-old girl, that was diagnosed with diabetes, and this is a shock to the family. You can imagine, right? Apparently, it's not genetic. The doctors don't really know why, and they had a name for it when it's not full on yet, but it's coming, and she now needs to learn how to adjust her life in accordance and probably take medication for the rest of her life. And I just wonder, and this is hypothetical, we're not saying this is working for this particular person, but as a hypothetical kind of idea, because I had an experience with a male who had diabetes for 10 years. He had to inject, whenever he was ingesting food, he would scan his food and ingest insulin to counteract whatever the body couldn't do by itself. And we only did one session, and as you said, it's only words, right?
Mm.
And I don't want to go into details, I don't want to take the focus away from you. But what happened was that the following 2 days, because we appealed with our words, whether those cells that are in charge to produce insulin, whether they wouldn't be willing to re-look at how much the body need and how much they produce, and whether it wouldn't be at all possible to bring a bit more harmony naturally into it. So it was very gentle words, right? And for 2 days thereafter, he misjudged the amount of insulin he injected. Luckily, in the safe, within a safe area, but he injected too much, which leads me to believe that his body, even though it was 10 years after the onset, it looks like started producing a little bit more insulin than it did before. So having said
So
that,
it responded.
and having that experience, in theory, pure theory, do you think, provided the client is ready and all the circumstances are perfect, that words could, in addition to the medical treatment, be helpful for such a young patient with being diagnosed?
So I'll be honest with you. I haven't had any experience with children and hypnosis as yet.
Oh, they're so easy. They're much easier as any adult.
I heard that they're very easy, but I mean, if we can use hypnosis, I mean, to assist to changing the nature or the progression of the disease, then it would be brilliant, because it means so many advantages for that child. I mean, if we can decrease medication, even, to a point where it's minimal, then I mean, how life-changing would that be? Just decreasing the amount of medication, that leads to there's added benefits, because then decrease side effects, decrease cost, decrease hospital stays. So it's like a chain reaction that we'll see just by reducing one thing. In this scenario, we're talking about medication. So if we could do that, then it's going to be brilliant. So there's so many added benefits there.
Yeah.
So,
yeah. Thank you for that. Yeah, children up to a certain age, and 8 is kind of on the verge where this analytical mind of ours kind of starts to take over. And before it takes over, that's why so many of our issues stem from childhood. Because we just simply absorb everything, good or bad or indifferent, and we absorb belief systems that then run the show and run our lives, and we are oblivious to them because consciously we don't remember that, but they're all sitting in the subconscious mind. So I also think if the child and the parents and everybody is willing and so on, it would definitely be something that I wouldn't rule out to try at least, huh?
Yeah, exactly. Because as you said, as long as it's controlled, as long as there's still the medical part, it doesn't hurt. I mean, you're not taking medication away, but you're testing to see what the control would be like. So yeah, definitely, because you're not advising to withdraw medication or decrease medication, but you're saying as an add-on, as a complementary tool, definitely, I would support it wholeheartedly.
Good to hear that. So now that we know the power of words, when the subconscious mind is available through the natural state of hypnosis, which feels very much like just super deep relaxation, and actually kind of a yummy feeling, because lots of feel-good hormones are also, coming bubbling to the surface when we are relaxed and we're not in anxiety anymore. So these words, with understanding the power of them, would you say that your communication with your patients has adjusted since you understand that?
Yeah, so I would definitely say I'm using language more effectively, and by that I mean using definitely more positive framing. I'm framing information in a more positive more positive terms. So I'm using hypno language. So instead of saying this is going to be painful, I would say you may experience a bit of pressure or discomfort. So I'm also, using waking suggestions when I notice that a patient is highly suggestible to reduce anxiety. I'm using words to comfort, to empower, to heal. So the doctor-patient relationship is becoming more a partnership. So I've always been holistically minded. I always listen to my patients. So I think that's what they enjoy about me, because I always believed in treating a person as a whole, body, mind, not just a symptom. But so this whole journey with hypnosis has just reinforced my belief and strengthened my belief in the mind-body connection. And I truly believe that to achieve lasting wellness, we really need to acknowledge and support this mind-body connection. So I think the other thing is active listening. So I think I'm listening. My listening skills have also improved. So I think in that way, those listening and language skills have definitely improved during my hypnosis training.
Cool. Very cool. So, we're going to have the shotgun questions that we keep super short. And then we have a final question that you can just, do as much as you want. So the quick fire round, right? One medical or one myth in the medical field about hypnosis that you would like to correct.
Okay. I don't know if it's a myth in the medical field, but it's a myth that I've encountered a lot, especially with patients, and it's regarding mind control, that the therapist is in control. So that one I definitely would like to address, because having experienced myself, while you're under hypnosis, in trance, you still are in full control. You can think, you can move, you can talk, and nobody can make you do anything that goes against your core values and beliefs. So that's one myth I definitely have to address regularly.
Cool. Very cool. So one thing medicine could learn from hypnosis.
So that's an easy one, and that's to be more patient or client centered instead of symptom or disease centered. If you understand what I'm saying.
Very nice. One thing hypnosis could learn from the medical field.
Okay, so with the medical field, we love standardized assessments, right? So I don't know if this is too much, and I also know what you're going to say after this. It would be nice to have a standardized assessment to see how hypnotizable an individual is. And I know what you're going to say. You can already assess that in the pre-talk, but like a nice standardized little form would be nice.
Yeah, and then the client may not change from day to day. Their psychological state has to be exactly the same, so that they're not deviating from the tick boxes.
And medicine likes standardized assessments, eh?
Yeah, I don't think I remember I went for a flight medical, and the doctor took my blood pressure many years ago, and I knew that all my life I had a low blood pressure and it was slightly elevated, and he said to me that just being in a doctor's office can sometimes raise the blood pressure. So I don't know whether your tick boxes are working for that.
Yeah, exactly. Yeah, that's for white collar hypertension. Yeah, no, that was it. Yeah, that was just
but it would be nice.
I wanted to see your reaction. That was done deliberately.
Okay, let's have the next one. Complete the sentence. Healing begins when?
When you truly let go and allow access to your subconscious mind. That's when the magic and healing can begin.
Wow. Okay. Whew. Last short one of the quick fire round. What has this journey taught you about being human?
So, what it's taught me is that we as human beings are definitely resourceful, and we have inner resources. We have the answers to our own problems, but we've just lost the ability to connect with these resources. So, I think that with using modalities like hypnosis and hypnotherapy, we can reignite that connection.
Beautiful. Beautiful. Wow. I don't even know whether I want to ask the last question, but maybe you feel drawn to answer it. How, so this last question, unless you have, of course, anything else to add,
No, no.
how do you see the future in your in your in your wishful thinking? How do you see the future of medical the medical field and the field of non-medical hypnotherapy? how how would you like to see them move forward, if together, in what way?
I would like to see them move forward together, like conventional medicine using or asking non-medical hypnotherapists to act as a complementary tool in helping patients, individuals, so that we can have a holistic approach to healing, because I believe that we do really need to get to the root cause. Because if we don't get to the root cause, we are doomed to repeat cycles.
Yeah.
So, I mean, with normal medical practice, sometimes it can be straightforward. With investigations, we can identify a cause and we can treat it. But that is not the situation all the time.
Yeah.
Actually, more of the time, it isn't, right? So, for those individuals where we're struggling to identify a root cause, I don't think we should just push them aside to the psychiatrist and say, okay, it's your problem now, and then it's more medical. I think we need to take assistance of, the complementary services like hypnotherapy and mind-based interventions, and use them together so that we can achieve true, wellness for our patients
Yeah.
and for people.
Yeah.
Yeah, I definitely work together.
I was just reflecting over our time together here now, and I think if I would look at it from a listener's point of view who doesn't know hypnosis so well, maybe what they would like to hear is um, there is no guarantee in your answer, and the people must understand that. But however you want to answer that, what kind of conditions or symptoms, in your opinion, where would you like either yourself as a hypnotherapist, or asking a patient maybe go somebody to another hypnotherapist, or however, what kind of symptoms, maybe more in an umbrella kind of, it's up to you how you say that,
Yeah.
what kind of symptoms or diagnoses would you say, there is definitely hypnosis something that comes up on my radar and that's something to consider?
Okay, so I would say definitely where there's an overlap between psychological and physical symptoms. And that you will see in conditions like obviously chronic pain, gastrointestinal conditions like irritable bowel syndrome. There's a big uh, anxiety trigger there. Skin conditions like your eczema, your dermatitis, insomnia. Insomnia is a big one. And can I tell you, I just dislike using benzos and sleeping tablets because it is not helping our patients. Actually, it's long-term use is more damaging. So, and there's so many other conditions, fibromyalgia. There's a lot because there's an overlap, but if you look at it, there's an overlap in a lot of conditions. So definitely where there's an overlap between psychological and physical.
Yeah.
So
Yeah, I wonder whether, um, uh, the broad public has an awareness. I can see it often, even in the classroom with students of hypnotherapy, when I'm pointing out that overlap from the psychological aspect into the physiological, into the body. In the beginning, many of them are a little bit disbelieving, and only when we touch this in class, when we explain to the layman in layman terms, how does that how does that arrive as a symptom in the body, does that actually become clear? So I don't know whether the public at large is actually aware of the
mm.
possible huge psychological impact on their symptoms. Would you say that's so?
So yeah, I agree, and I feel like the awareness is rising though, because
Yeah.
I mean amongst patients, when we discuss, and I don't know about everyone else. I can't speak about everyone, but when I am with my patient, we have a discussion. So when I am treating them and I discuss my findings, I discuss what's going on in their body. I explain to them, and then when I prescribe medication, I explain what I'm prescribing, what it is doing, why I'm giving it to them. And the reason I do this, because I feel like if you understand why you're taking this medication, what it's doing in your body, you're going to be more compliant, right?
Absolutely.
And so with me, communication has always been at the forefront, right? So now when I talk to patients, I find patients are realizing, because I also explain to them what stress does, how stress affects the body, and it increases those stress hormones, and then how that impacts on other body systems and causes like a chain reaction, and then triggers inflammation, and what inflammation does, but in simple terms, nothing hectic, because
Sure.
they need to understand. So I do agree with you, but I also feel that there is an increasing awareness now on the effects of stress on the body. And I think people are becoming more mindful. Hey, I feel that there's a definite shift, which is a
Beautiful.
good thing.
It's a good
Which is,
thing.
yeah, it's a good thing. We need, so the thing is, over the last 2 years, I mean, I've personally been through a lot, and I've questioned everything. And I think my core question was, what is my purpose, right? And I know, I always tell people, I know I'm living my purpose, but I feel like there is definitely more that I should be doing. And I felt a very strong, this is not medical or anything, I just felt a very strong pull toward this modality. I felt like this was something I needed to do, and I'm slowly piecing it together, and I feel like, yeah, there's a reason I needed to do this. I feel like this is part of my journey, and I feel like with this modality I'm better equipped to help people, but also to educate people, not just just help them, to educate them, so that we can all become more empowered,
Yeah.
and we can manage our own body
Yeah.
more productively.
Yeah,
You
taking
know,
taking to a degree responsibility also back, and
yes.
maybe, and that's a little bit of a drawback of having medical schemes available, is you intend to go to the doctor much quicker, because it seems easy and it's the done thing, than to listen to your body and do a bit of search, what could this possibly mean. But yeah, that's, you started with the 1 day course that we have when we teach self-hypnosis. I really
Yeah.
wish everybody would do that, because it's so valuable when you start understanding the subconscious mind and what it is about. And those details, of course, are on our website. So I think it is time for the last famous words. What impression would you like the listeners, what impression would you like to leave with the listeners? What do you want to say as the ultimate summary?
So I think what I'd like to say is that I hope that after they watch this interview, that the public understands how significant hypnotherapy is as a complementary tool moving forward, to help people to attain psychological and physical wellness. I just hope that they understand that it is a tool that is based in science and that it is safe and that they are definitely proven results. I hope that is what they take home from this interview. And I hope that they can see how passionate I am about it.
Yeah,
I'm passionate about medicine and I'm passionate about this because I'm passionate about healing.
yeah,
So I hope that's what they get from this.
very beautiful. Taskia, is there anything else you would like to add?
No, I just want to say, like, the whole course was amazing. And I have to say, I simply loved the past life regression. That was the most amazing course. Everything, all the courses were amazing, but I felt like doing past life regression is such a privilege and an honor. And I have to say to you that I take it very seriously. I respect it tremendously, and I feel there's so much of benefit in it. And I know it's a little bit of a touchy subject. It's not something that everyone is open to, but I think that was truly amazing. And I think all you guys there at SAI are just amazing, so supportive, and your teaching is brilliant. So I hope that more people can come to you and gain from your knowledge and your experience and feel the love.
Wow, I think this is the perfect point to stop. Thank you
Yeah.
so much. That was amazing.